most everything you should need to know. So I was already recording. Okay. 3, 2, 1. I recorded, but that's only in case you have a problem. Because I used to always do that. I would have problems once in a while too. All right, so here we go. This is chapter 16. Now, I have to tell you that I think chapter 16 is really one of the most important chapters on the brain and the nervous system, because the autonomic system is the part of your brain that controls everything that is out of our control. Things like blood pressure and heart rate and all that kind of respiratory rate and so forth. It's kind of out of our control, but yet it's where all the drugs work. Most all of the heart drugs, blood pressure drugs, kidney drugs, diuretics, all of that stuff works out of our own control. So it's controlled by the autonomic nervous system. And when you hear autonomic, think automatic, because you don't have to think about it to make it work. Okay? We had a little snow out in Dallas a few times. That was on our farm. Anyway. Okay, so this slide here is going to sit here for a while because I'm going to talk about the two divisions of the autonomic nervous system. And maybe I've mentioned this before. If not, I'm sure all of you have heard about it before. But just remember that the autonomic nervous system operates outside of our awareness. In other words, we don't think about it, like I just said. These are automatic things. There's two basic divisions, and I don't know why in the hell they named them this. One's called the sympathetic division, and one's called the parasympathetic division. Don't ask me why. But just think of it like this. Just listen to me for a second. Let's talk about the sympathetic division first. Okay? The sympathetic division is called the fight or flight division. Now, as we go through all of this, I will talk a lot about the tiger walking into the room. Okay? Now think about it. If a tiger were to walk in the room right now, what would happen inside your body? Your heart rate would go up.
Breathing faster.
You'd start breathing faster. Your pupils would dilate so you could see the tiger better.
Blood vessels dilate.
Blood vessels especially, well, some blood vessels will dilate.
Muscle.
Blood vessels go into your muscles and so forth would dilate, right?
Constriction of blood vessels to digestive in other areas.
Right. You'd cut down blood because you wouldn't digest, you wouldn't make urine, so you would cut down the blood to those things. Basically, you would get ready, you would get your body ready to either fight that tiger or to run like hell and flight and run from it. Okay? That's where the fight or flight comes from. Now, let me just say to start with that it's more than the things we just talked about, because it's also down at a chemical level. Okay? So this fight or flight thing goes farther than just increasing your heart rate. It goes all the way down to glucose metabolism, protein metabolism, all that stuff, because your body is suddenly releasing a bunch of stuff to make it easier for all your muscles to work and so forth. Okay? The parasympathetic division. That's the sympathetic division. And just so you know, the sympathetic division isn't completely just nerves, because it also involves the adrenal gland. And when we talk about, let's go back to this just for a second more on the sympathetic system. When you watch Monday Night Football, you've probably heard the guys say, boy, that guy looks like he's really pumped up on adrenaline. Right? You've heard that. What's adrenaline? What's adrenaline? Huh? A hormone? Well, sort of, yeah.
Epinephrine.
It's epinephrine, that's right.
Neurotransmitter.
It is a neurotransmitter. And epinephrine is the drug that in the fight or flight system gets released. So when that tiger walked in the room, we sent signals to our adrenal gland to release a bunch of epinephrine, and it pumped us up. I mean, it really does. Okay? Now, I don't know if football players really get pumped up, but I think they do. But I think it's all in their head as much as anything. All right. So when you think sympathetic system, think epinephrine. Okay? All right, let's go to the other one now. Parasympathetic system. Rest and digest. Okay? All right, we killed the tiger. He's gone. It's time to rest and digest, which means we can now chill out. We can rest back. Our heartbeat can come down. Our breathing can come down. Our blood pressure can come down. Blood sugar can come down. We can now start sending some blood to our guts to digest our food. During fight or flight, it was just sitting there with no blood flow to it, right? And we might even think about having some sex, because rest or digest just happens to include sex. Wow. So, in rest or digest, in the parasympathetic system, all of those things that we talked about earlier with our pupils getting bigger are now going to get smaller. We don't have to see as well. Heart rate's going to come down. Respiratory rate's going to come down. How about the breathing tubes? I didn't mention that first time around. What happens to the breathing tubes in our lungs during sympathetic?
Your bronchioles dilate.
Dilate, right. Good. We'll talk about that a little bit more when we come back to it. So during rest and digest, what would happen to our bronchial tubes? They would clamp down a little bit because we just don't need as much oxygen, right? We're taking it easy. Okay. All right. So now let's beat up on these things some more. But I think if you keep the things that I just talked about in mind, you've got the whole thing. You got the whole picture, okay? I'm going to tell you how it works exactly, but just think fight or flight, rest and digest. Everything's going to fit into one kind of category or the other. All right. The sympathetic division, this fight or flight thing, it's not active all the time, okay? It only kicks in during exertion, stress, or emergency. In other words, most of you right now, I would like to think, are not really in a sympathetic state of mind. You're taking it easy, right? The parasympathetic system is the one that's in control all the rest of the time. And I think that's kind of important to think about. Isn't it nice if we can stay resting and digesting most all of the time? It's easier on us. It's easier on our bodies and our metabolism and so forth. In a lot of the structures of the body, the two divisions, the sympathetic and the parasympathetic, work independently. In other words, some things like your sweat glands, they really don't get innervated by both sides. You just need them when you want to sweat, right? So they're innervated by the sympathetic system, not so much by the parasympathetic system. Whereas your heart has innervations from the parasympathetic system. The parasympathetic system sends nerves to the heart that make it go faster. And the parasympathetic sends messages to the heart that make it go slower. And so the heart rate and the strength of cardiac contraction, what do we call that? Inotropy? Oh no, wait a minute, you guys are in 2. I get confused. Sorry. Yeah. Anyway, yeah, how hard each heartbeat actually beats. Well, you'll learn about that when you get to cardiac at the end of this term. Okay. So sometimes the two divisions work together, each controlling one stage of a complex process. Now let me tell you what they're trying to say in that line right there. One that I can think of that tends to be pretty important to the species. And I said that sex tended to be kind of a rest and digest kind of thing. Well, just so you know, it is rest and digest until you get to that last little bit. When you get to ejaculation and emission in the male, that is very sympathetic. That is very fight or flight. Okay? So it basically takes the parasympathetic system to get the erection going and and of course you have to throw in some foreplay, but it's not really that important. But anyway, the final aspects of it are very much sympathetic. They run on adrenaline and run on epinephrine as well.
So what's happening when people suffer from anxiety disorders? Are they releasing
Epinephrine.
a lot of epinephrine?
Yeah,
Just out of their
runs their
control?
blood pressure up. Go ahead.
I'm just saying, are they just releasing a lot of epinephrine just out of their control? And
Yes, they are. If the anxiety's out of their control, then the release of all this stuff. We're going to talk about some other neurotransmitters besides epinephrine, but yes. Okay? All right. Now, here's a thing that you need to know is a major difference between the sympathetic division and the parasympathetic division. They both have two nerves that carry the message out to the target organ. There's one that's called the preganglionic fibers, and let's just say these come from the spinal cord and they can come from the brain. But they come down, they go out the spinal cord, they go out through the spinal nerves, remember those guys? And then they go out there to the, very quickly, there's some little rami communicantes that come off and go to the sympathetic chain, remember that? And once they get to that sympathetic chain ganglion, what happens in ganglions? There's a synapse, right? And that synapse is between the preganglionic fiber and the postganglionic fiber, the one that's before the ganglion and the one that's after the ganglion. And indeed, that ganglion, remember, is very close to the spinal cord in the back, and so the postganglionic fibers are kind of long. Okay, if they're going to go to the intestine or they're going to go to the heart, they're going to go all the way from the spinal cord, from those spinal ganglion, those spinal sympathetic ganglion. Okay, so that's where this point here comes from, and it says for the sympathetic division, the preganglionic fibers are pretty short, postganglionic fibers are pretty long. That's going to be just the opposite for parasympathetic, which we'll get to in just a second. So, I think I've talked about this. The whole idea of the sympathetic division is to prepare the body for crisis, and it's going to stimulate, it's going to be all the way down to a metabolic level as well. Increase alertness. Do you think the tiger would have any trouble keeping you alert if you walked in the room?
Nope.
You know, it would work pretty good. Here's that picture I was trying to draw with my hand up there, which is really something I should never do. Here's the spinal cord. Here's the motor roots coming out on this end, remember? And here's the sensory roots coming in through the dorsal root ganglion, you remember that? And you notice as you go out through this motor root, here's this preganglionic neuron that can start right here in the spinal cord, or it can start farther up. Comes down, it goes out through the ventral root, goes out through what's called the spinal nerve here, remember where the ventral and dorsal roots come together. And then it goes out through one of these little communicante things, the efferents or the afferents. Well, this is the efferents. And it comes out here, and sure enough, it synapses right there in the ganglion. And then some of the fibers go on out to innervate the visceral organs, for example. Some of them come back in and go and travel out with the spinal nerve. But the point being that the sympathetic nerve fibers all synapse here in the sympathetic ganglion and then take a long trip out to the organ that they're going to affect. Okay? The sympathetic chain ganglion do not service your entire spinal cord. They don't go all the way from the very top to the very bottom. They go from spinal cord segment T1, the first thoracic, in other words, there's none coming out of the cervical area, and it goes down to L2. So that means all of the sympathetic fibers have gotten out of the spinal cord by the time you get down to L2. That means L3, 4, 5, the sacral nerves and the coccygeal nerves, they don't have any sympathetic fibers coming out of them. Yeah?
Are they just sensory? They form the plexus? Is that why?
No.
Like from C1 to C8 is just the cervical and the cervical plexus and they
That's correct. But the point being, going back, they don't have these guys right here. I'm sorry, they don't have these guys right here. They don't have these white rami. Yeah, they're sympathetic, but they're also motor. Whatever they do is what they do. These fibers here just jump on and ride with all these other nerves that go out there. So yeah, there's sympathetic nerves, a few sympathetic nerve fibers that go all the way down the arm, riding on C6, C7, C8, and the brachial plexus, but yet they didn't come out of the spinal cord at that level. Okay? Thank you, that's a good point. Okay. So here's an example of exactly what you were asking. And, I told you that the first fibers come out at T1 level, and at T2 and T3, and all the way down to L2. But here, in order to service these areas up here, there is a sympathetic chain that goes up there. It just doesn't get any more input from up there high. And then they all kind of do their little anastomosing thing, and they go out, and some of them go to the eye, right? Because remember,
Pupil dilation.
Salivary glands.
Don't
You
eat.
quit making spit if you're looking at the tiger, right? The heart goes faster, the lungs breathe more, and so forth. I saw a hand.
So with like the reaction, like let's say you put your hand on something hot and you have that reaction to like jerk it away.
Right.
Would that be part of the sympathetic?
No. That is a spinal reflex.
That is, okay.
Just a spinal reflex. It doesn't ever make it up to the brain. It doesn't make it to the sympathetic system. I mean, once you think about it for a minute, you're going to probably hype up a little bit. But no, instantly it's just a single monosynaptic or bisynaptic reflex that usually is done at the spinal cord level. Yeah.
This is why football players usually puke or that during big games because they get a huge jump of epinephrine. They're getting all pumped out.
I think it's all the pills they took before they went out on the field, actually. I really don't know. Okay. Now, the other part of the sympathetic system, besides those sympathetic nerves we've been talking about that come out of the spinal cord, the other kind are nerves that go straight down to the suprarenal medulla. And so the sympathetic system, the fight or flight system, has fibers that go all the way down to the adrenal gland and cause the adrenal gland to suddenly release all this epinephrine. Epinephrine, also called adrenaline, 75%, 80% of the secretory output is epinephrine. There's a little bit that is norepinephrine, which is kind of a brother of it. Anybody know why it's called adrenaline?
Because it's produced when they.
Well, it is coming from the adrenaline. Yeah, the drug was actually named by the Lilly drug company, adrenaline, way back in the 1920s, because that's where they used to get it from. They'd go to the horse slaughter yards and the cow slaughter yards, and they would grab their adrenal glands out, and they would take those adrenal glands and grind them up, put them in a blender of some kind, and blend them all up, and then
smoothie.
and then get the epinephrine to come filtering out. So that's why it was called adrenaline. Pretty cool, huh?
The adrenal glands on top of the kidneys.
Yeah, adrenal glands are on top of the kidneys. They're also called the suprarenal glands. Okay, we're now calling them the suprarenal glands because they live right above the renals, the kidneys. Okay? All right. So once this adrenaline is released, it is no longer inside nerves, right? It's just in the bloodstream. So it circulates then around as a hormone and carrying these extra neurotransmitters throughout the body, which cause all of these things that we've been talking about when the tiger walked in the room. Once you release the epinephrine, it doesn't go away right away. And that's kind of a good thing. Once you've seen the tiger in the room, you want to get hyped up and get ready to fight or flight him, or fight or run from him, right? And you don't want that to just go away in a few seconds. You'd like it to stick around for a while, and it does. So, well, that's probably one of the reasons why when you go through a really emotional experience or some really fight or flight kind of thing, you have a hard time laying down and going to sleep right after that. You know, you're still pumped up for a while. Now, the reason I mention that is because the parasympathetic system works exactly the opposite. So, remember, adrenaline, fight or flight, hangs around for a while. Once it's been stimulated, it's going to hang around a while. Here's the 7 things that the sympathetic activity is: heightened mental alertness, increased metabolic rate, reduced digestive and urinary functions, energy reserves, ATP starts getting poured out and getting ready to work, increased respiratory rate, respiratory passageways dilate, increased heart rate, blood pressure, and the sweat glands get activated. All right, so you ought to know those. I mean, you ought to at least realize that those are all sympathetic. Yes?
Why do people get addicted to that, though?
What?
Why do people get addicted to that adrenaline rush?
I have no idea. I guess they just like being hyped up or being in control. What do you think? This banana eater back there?
Well, I think part of that adrenaline rush is that substance abuse, morphine abuse too, which is
Yeah.
acting on the brain. So
Yeah.
there's those two pieces. Yeah.
Good point. All right. Now, there are a number of these neurotransmitters that go into effect here. And we call these the sympathetic drugs, basically. And they have different receptors. And norepinephrine and epinephrine affect these in different amounts. You don't have to memorize these. Please don't write all this down. I just want you to know that sympathetic stimulation does what I've told you it does. It hypes you up and does those 7 things we just had on that list. Now, the alpha-1 receptors are a little bit different. They're all excitatory. They make your heart beat faster. They make your blood pressure come up. Alpha-2 receptors work through cyclic AMP in the cytoplasm, and they kind of help coordinate the sympathetic and parasympathetic. Then there's these beta receptors. Beta receptors. What do they do? Well, they change a lot of this is one of the most common drugs in America right now, are what's called beta blockers. Okay, y'all have heard that term before maybe? Beta blockers. Now, if you think about that beta is going to make your heart beat harder and make it beat faster and so forth, what does the beta blocker do?
Keeps that from happening.
It keeps it slowed down. It lowers your blood pressure. So what is it given for?
High blood pressure.
It's given for high blood pressure,
Anxiety.
a little bit. It's actually a PED, a performance-enhancing drug. Guess who takes beta blockers to do better in the Olympics?
Athlete?
Well, some athletes. Which ones? Because if you were racing and you were going to run a mile or run the 10,000 meters, would you want to be taking a beta blocker to slow you down,
No.
slow your heart down? No.
Distance runners.
No, not distance runners.
Boxers.
Nope.
Skiers?
Bikers?
No, not bikers.
No.
The answer is, you know those crazy guys that do that cross-country running or cross-country skiing, and they have a gun on their back, and then they go to these places and they flop down on the ground and they pull off their gun and they have to make about 5 shots in a row and hit the target, and then they jump up and go another 10 miles to the next target set. That's the PED they've been using. A bunch of them got caught using beta blockers because the beta blocker would slow their heart down. Think about it. You're exhausted. Your heart's beating 90 times a second, or probably 140 times a second when you flop down there. And then you've got to, with your heart beating 140 times a minute, you got to hold that gun still and hit those targets. So yeah, they started taking
What is that called?
beta blocker.
The 3 guns?
The sport.
What's the event called?
Yeah, what is it called? It's like the
Rifle shotgun.
I don't know. Cross-country ski and shooting. How about that? It always amazes
Ski
me
shoot?
to watch them do it. I just think that's got to be one of the craziest events. But it's really big over in Scandinavian countries. I mean, they just think that's the greatest thing going. They probably draw crowds like American football to watch that silly thing. All right. So anyway, beta receptors are a big one. Beta blockers. Not only do they lower your blood pressure, but they slow your heart. And if you've had a heart attack, think about it, and maybe you've lost a little bit of heart tissue from that first heart attack, wouldn't it be nice if you could sort of rest the rest of your heart a little bit and keep it beating a little bit slower? There you go. So beta blockers are really common, yeah.
I know, I'm a personal trainer, and that's one of the things you have to know if someone's on is a beta blocker.
Right.
Because, like, your heart, it lets you know if you're working too hard, and if someone is on a beta blocker, they don't always know if they're, exerting too much.
Yeah.
And it can be, detrimental to, other parts.
Yeah.
So I can't imagine it's very good for the skier guys to take that.
No, it slows them down, but it allows them to calm down when they
Right.
stop. I mean, I agree with you. I don't know why they would want to do that, but I guess it works. It got them some medals. And anything's worth it for medals, right?
Dust.
So anyway, you can break this down even farther into beta 1, beta 2, beta 3. Beta 2, I'll just mention real quickly because beta 2s are kind of nice because the big thing they do is they trigger this relaxation of the smooth muscle along the respiratory tract. So why do you think you might want to take beta 2 drugs? Asthma, that's right. So if you're chronically having contraction of those muscles and they're constantly in spasm a little bit, and so you're finding it hard to breathe, then a lot of the people, and you'll see it advertised on TV, they usually take this drug as a inhalant through a little squirter thing.
Butyral?
Albuterol is one of them, yes. Okay? Now, there's another set of neurotransmitters that work in our bodies that are called that work off of the release of nitric oxide. This is not nitrous oxide. Nitrous oxide is laughing gas. Okay, it's used in surgery and used in dental offices a lot. This is nitric oxide. So instead of being N2O, it's NO. Anybody know what it does? Have you ever heard of Viagra or Cialis? The biggest selling drugs in the history of the world. Okay? People were literally paying $50 a pill for it when it first came out because it helps you get and hold an erection. And let me tell you, I can't speak on this on personal experience, but having been a physician and talked to a lot of patients, this stuff really works. It really works. And when you see those ads these days, I have to say every time I hear that lady on TV, she's sitting there in bed and she's got this kind of sulky thing on.
Guys,
She says,
let's all talk about it.
huh?
The British one that uses her.
No, she says,
With your fella.
women love to cuddle after they've, well, been with their guy and they want to cuddle. But 40% of all guys above the age of 40 have some degree of erectile dysfunction. That's another cool thing they did. They made up a really neat name for it. Erectile dysfunction, ED. Anyway, she says, and then the other question I have about all of this is, what's the deal with the two tubs? Cialis, there's two tubs sitting on the edge of a cliff out in the wild blue yonder. I don't know where they get the hot water for them. But anyway, and what does that have to do with having an erection? Who wants to have an erection in a tub? But anyway. All right, enough of this. So this causes vasodilation and increased blood flow in certain areas that it talks about. Well, that's what it is. These are the nitrooxidergic synapses. When this was discovered, when science discovered that there were these nitric oxide receptors, then they started looking for drugs that would make them stimulated, and that's when they came up with these ED drugs. Okay. Now let's go talk about the parasympathetic division a little bit. We're going to the rest and digest side of things. And remember that in the rest and digest side, the preganglionic fibers start up in the brain stem and they go all the way down to the sacral segment. So they're called the craniosacral. In other words, whereas the sympathetic system gave off all of its fibers between T1, right, and L2, the craniosacral does it from up here in the brain and way down low in the sacrum. Get it? Okay? So one's called the thoracolumbar, that's the sympathetic, and the parasympathetic is called the craniosacral, as you see right there. Now, the deal that's different with these guys is that the ganglia, whereas the sympathetic system had its ganglia right beside the spinal cord in that sympathetic chain ganglion, remember? The parasympathetic system, they send long presynaptic fibers. They go all the way out to the organ. So like to slow down your heart, which is what the parasympathetic system is going to do, it sends fibers all the way from your brain, all the way down, all the way out to your heart itself, and they synapse right on the surface of the heart. That's where the cardiac ganglion is found. And when you go to the abdomen to make your digestive system work or not work, those fibers are in the celiac ganglion. They're right in the abdomen, right on the intestines, basically. The point being is that the preganglionic fibers are long and the postganglionic fibers are really short, like from the surface of the heart to the heart. Yeah?
Is that because you're spending most of your time in the parasympathetic system? So maybe you're gonna spend more
I don't know
energy?
why.
Okay.
There's a lot of this stuff I don't know why, but that's just the way it is. So I'll answer it like that. But yes, you're right. You are in the parasympathetic system much more. Okay. Now, let's talk about this because one of the things I think it's important to know is that these nerves don't make their own nerves, really. They just jump on and ride with other nerves. In other words, the fibers of the parasympathetic system. You don't have just nerves that run through your body that are just purely parasympathetic. They always jump on other things. And so a few of the axons that are in the oculomotor nerve, the facial nerve, glossopharyngeal, and vagus nerve, parasympathetic fibers have jumped on those. So, what parasympathetic fibers might jump onto the oculomotor?
Sympathetic.
What parasympathetic? Huh? Rest and digest. What's going to happen to the pupils? They're going to constrictor. So the parasympathetic fibers that go to your pupil that are going to constrict your eye, the way they get there physically is by riding the oculomotor nerve. Got it? Now, what else does the oculomotor nerve do? Huh? It opens your eyes, right? It lifts up the levator palpebrae superioris. What else? What other muscles does it go to? Superior rectus, inferior rectus, medial rectus, inferior oblique. Very good. So it goes to 4 of the 6 main eye movement muscles. It also goes to the levator to open it. Okay. Now, what nerve closes your eye? What? How does it do that? What muscle makes it close? Yeah, orbicularis oculi. Okay? So that's the facial nerve, which is number 7, right? Which happens to be the next one on the list here. And yeah, it closes your eye. Okay? We're having a quiz on this. You guys ought to know this, right? And I know you do. All right. Number 11, the glossopharyngeal carries a few fibers down, especially down to your tongue and pharynx and some of the glands down in that area.
Salivary lacrima.
Huh?
Salivary.
Salivary glands, right? Your spit glands. And then the vagus nerve, which carries by far and away the most parasympathetic fibers. The vagabond nerve that goes all the way down through your body. It goes to the heart and the lungs and the digestive system and all of that jazz. Okay? All right. There's vagus nerve. I'm going to leave it with you. Here's, I told you that the ganglions were all out near the organs instead of being back by the spinal cord. Here's just some examples, but I'm not going to hold you to these. I don't think you need to know. Just know that you've got this thing called the pteropalatine ganglion, which is up near the eyeball, and it is where the nerves synapse that are going to the lacrimal gland to make you make tears, and the ciliary ganglion, which makes your eye open and close, and the submandibular ganglion goes to make, and the otic ganglion both make your spit glands make, and then the ganglions for the heart are actually just right there on the surface of the heart. And the ganglions for the lungs are just right there on the surface of the lungs as well. So remember what we said about, for the sympathetic system, the preganglionic fibers are short. In the parasympathetic, it's the postganglionic fibers that are short. And the preganglionic fibers are pretty long. Okay? Well, we had a list earlier of all the things that the sympathetic system does. Rest and repose, rest and digest, whatever you want to call it. So the parasympathetic system makes your visceral activity happen, makes your bowels crank along and crunch and peristalsis to happen and mix up your food and all that jazz. The parasympathetic system tends to make you conserve energy, and it promotes sedentary activities. So you would think that sleep is basically a parasympathetic activity. It decreases your heart rate, blood pressure, and so forth. Makes you secrete salivary and digestive glands because that's part of digestion, right? So it makes them secrete more. It also increases the motility and blood flow in the digestive tract. And urination and defecation, we'll cover those when we get to them in their chapters. But yes, I'll just say yes. They're complicated. My dad lived the last 20 years of his life on the toilet, it seemed like. He was so hung up on his bowels, and a lot of older folks are. And it's such a struggle for him and the same thing with urination in old guys. Prostate gets bigger and urination becomes harder and harder. You've seen all the ads on TV for that too. You know, these days, I mean, it's like some of the ads ought to be X-rated. You know, anyway. So I think I'll stop there on that stuff. Here's this vagus nerve that does all these things that we've talked about. I think we can skip through that. Relaxation, food processing, energy absorption. And this is the point that I wanted to make. The localized effects of the parasympathetic system only last a few seconds. Now, why would that be important that the parasympathetic system only lasts a few seconds? Let's just say we're all in here and we're relaxing and we're taking it easy, and the tiger walks in the door. What do we want to have happen real quick?
An instant flip to sympathetic.
We want to instantly flip to sympathetic because our life will depend on our sympathetic system working and kicking in really well. And we don't want to have that sympathetic system then have to overcome the parasympathetic system, which will continue to work, right? If it lasted a long time. But as you can see, it has to be re-stimulated every few seconds to keep you resting and digesting. And that's what you want, because if you need to go into sympathetic, you want to be able to go really quick, and you want that to go away. You want the parasympathetic stimulation to go away. Okay? I think we've talked about all these: constriction of pupils, secretions of hormones, and that. You guys have got it in the notes if you want to look at them. But I think we've talked about all of them already. Let me tell you a story about respiratory passages. Have I told you my story about the asthma attack? Mm-hmm. Okay, the girl, I was teaching in the high school out in Dallas one time, and there was a girl that I knew because her dad was the assistant police chief in town. And I have to tell you, if you're a surgeon and you go to the emergency room a lot, you know the cops really well. They all know you, and you know all of them. Because they're always there, dragging in drunks and dragging in people from fights and dragging in people that have broken the law, and they say, oh, my head hurts, I better go get it checked out. And of course, they just want to stay out of jail a few more minutes. So they all get drug up to the ER. And as the surgeon, you get to know them all really well. This girl was the daughter of the assistant police chief, and I knew that she had asthma, but that's about all I knew. And after I retired from surgery and I was doing student teaching up at the high school, I heard all this ruckus in the hall. And the deal was that she was allergic to peanuts. And as you probably know, there are more people allergic to peanuts now than everything else in the world. For some reason, the antigen of peanuts is very highly allergic for lots and lots of folks. Well, this was a number of years ago, I guess probably 15 years ago. And the home ec teacher wasn't even thinking about it. And the school hadn't thought about it. There were no policies or anything. And I remember walking down the hall that day, and there was this wonderful smell of peanut butter cookies cooking in the home ec department. It was fantastic. And everybody's thinking, God, I hope the home ec girls bring some cookies to my class, you know. And so forth. Well, anyway, then there's this big hubbub, and this girl is on the floor basically dead. Her heart has stopped. She is not breathing. She's in anaphylactic shock. She's having an asthma attack related to peanuts. Wow. Just what she breathed in. It doesn't take much.
Oh, she didn't even eat it?
Huh?
She didn't even eat it? It
No,
was
she
just
did not
from
eat
the
it. She
smell?
just breathed it.
Wow,
She knew not to eat it.
that's hardcore.
That's hardcore, yes. And so when you get those little things on in McDonald's, when they give you the little things that have the crushed up peanuts on it, and it's this really heavy duty plastic, and it said, you know, and all these stores you go to say peanuts are used in the processing of different things, and you know everybody's trying to cover their butt about this because it is such a serious deal. Well, anyway, somebody remembered that this girl had an EpiPen down in the office because she had, you know, they had sent in forms and stuff. And somebody went running down to the office and got her EpiPen. Does anybody know what an EpiPen is?
Epinephrine.
What's an EpiPen?
It's a shot of epinephrine.
It's a shot of epinephrine that basically just comes in a little stick that looks about like that. And you don't really have to do anything. Maybe break a tip off the end of it and you just go boom. And that automatically fires it. It automatically injects it. The needle comes out.
It
Boom.
hurts.
And it hurts. Yeah. Gave her the shot. Within a minute, she was up feeling fine. Now, the drug is epi. It's epinephrine, right? Now, what does epinephrine do to those breathing tubes?
Dilates.
It opens them up. And that's what saved her life. And that's what saves kids all the time. And, you know, EpiPens are, I saw legislation proposed the other day, they would put an EpiPen on every school bus. They would put an EpiPen in every police car, and on and on and on. And, you know, it's just a matter of having one there to give to somebody when they really need it. Anyway.
Does it only work on peanut allergies or all?
Oh, no, it works on any allergies.
Anything that cuts it down.
I'm sorry?
I think it works on anything that closes up your
That's
airways.
correct. It works on anything because what it does is the epinephrine is overcoming the parasympathetic stimulation that's going on. Remember those mast cells
Histamine.
that we learned about back when we were in the second day of 231, and they have these granules in them that release two things.
Histamine and heparin. Histamine and heparin.
Histamine and heparin, yeah. And, you know, that's why we all take antihistamines for allergies. Antihistamines are fighting the histamine because histamine is causing the parasympathetic stimulation. So you take the antihistamine to fight that so that you can breathe and your nose doesn't drip all day long and so forth.
Do people use EpiPens for asthma attacks?
Yes, exactly. That's the most common usage of them, like this girl. Okay, as I told you, some of the things have dual innervation. I talked to you about the heart, and the heart has both sympathetic and parasympathetic working on it. The heart, yeah, I just said that. So parasympathetic innervation dominates under most conditions, and so it keeps your heart beating slower, keeps your blood pressure lower, allows you to rest and rest your heart as well. And crisis, which is sympathetic then, this causes stimulation of the sympathetic, and obviously it does everything that we know it does. It makes the blood pressure go up, it makes the pulse rate go up, it makes the heartbeat stronger, and also notice that it actually inhibits the parasympathetic innervation. But remember, parasympathetic innervation cuts itself off in just a matter of a few seconds, because it's very short-lived. Okay. We've talked about the parasympathetic and we've talked about the sympathetic. There's really kind of a third system the book talks about, and it's called the enteric nervous system. Now, what do you figure that means? Enteric?
Something within.
Guts. Right. Your intro.
Imperial.
What'd you say?
Oh, it's like when you have enterobacters, it's like what lives in your
Enterobacter
guts.
is an example of a GI bug. Yeah. Okay. So the enteric
Visually.
nervous system is the third system, and it's pretty extensive in the digestive tract walls. But when I think about it, first of all, it's not a very big system. It's pretty small. Mostly your digestive tract works on its own reflexes. In other words, if the stomach is full, it contracts more. If the stomach is full, the stomach releases more acid to digest more food. And those are all reflexes that are locally involved. But this system is kind of the nervous input to your system. How many of you have gotten really nervous before for some reason, and suddenly you just got to go to the bathroom in the worst way? I mean, it happens, right? Shit happens. And so there's the deal. And that's really the enteric nervous system. It's pretty uncommon. We don't activate it very often. I would just let it go at that. Let's talk about higher order functions for just a minute, because there are some things that are involved in this parasympathetic-sympathetic system that involve your cerebrum. You have to think and figure out stuff before you can decide whether or not to activate your sympathetic or parasympathetic system. For example, the tiger just walked in the room. Does it take your cerebrum to interpret the fact that, hey, that's a tiger, that's not a little kitty cat, right? So our cerebrum is involved in a lot of this stuff because we have to make that decision, first of all, and if we do and we say, oh yeah, that's a tiger, then we fire off our sympathetic nervous system. Does that make sense? Some of you have probably been exposed to something in your life that was so gross and so disgusting that you went out and vomited after it. Haven't? Yeah?
Degloved finger.
Degloved
Partial
finger.
amputation.
Yeah, there you go. Partial amputation. Pretty disgusting. But it took your brain for you to interpret that that was something really out of the normal. Okay? So, this is not, it involves conscious and unconscious information processing. You got to think about it. No part of this, it's not a programmed wiring of the brain. Can adjust over time. Yeah, if you were cutting off heads all day long every day, I bet after a while it wouldn't bug you that much. Yeah. Did you have one thing?
I had a question.
Yeah.
About the enteric nervous system.
Yeah.
It seems that if it's like activated by feeling nervous, that the sympathetic nervous system would be involved in that, which is supposed to stop your digestive system. So what's the difference between the two?
Well, the difference is that what we're talking about now is things that come from the cerebral cortex up there. They're not coming from the sympathetic system.
Mm-hmm.
They're very abnormal, and they trigger the parasympathetic. They trigger the enteric nervous system.
Okay.
So it's not really sympathetic or parasympathetic. It's the enteric. Okay. Talk for a minute about states of consciousness. You guys seem to be all awake right now, but let's face it, we all get tired. We sometimes go to sleep, and then if you're really having struggles with your brain, you go into what's called a coma, right? So we're going to talk about the different levels of consciousness. And I can tell you, of all of the things that you evaluate when you're talking about whether somebody's brain is working well, it's much more important that you're conscious than that your pupils react or that you can feel your arms and legs or anything. The state of consciousness of a patient is the most important thing to assess when you're trying to assess whether their brain is working right. You could all buy that? Okay.
They're an observant type.
So there's many gradations of this. You can go from being sleepy to being comatose, you know. And obviously, if you're not wakeful, you don't have enough CNS activity going on. And so we have this thing that we talk a little bit about in this chapter called sleep. I think I talked to you guys a little bit the other day about sleep apnea, right? No, that was in 233. Okay. Well, sleep apnea is when people fall asleep. I mean, during their sleep, they stop breathing, okay, which then leads to lots of problems. But sleep is important. We need it to rest our brain. Well, my story is this. I went down to a duck game one time with a friend of mine, and he was a big old boy. He was probably 325 or so. And so we went out and the game was in the morning, and we went out had a couple of drinks and went back and went to bed, and we were in 2 separate beds, you'll be glad to know. And I went off to sleep, no problem, and I woke up about 3 in the morning, and I'm listening to this guy breathe because he's snoring really loud. And it's like, and then he goes, and I started counting. 1 Mississippi, 2 Mississippi, right? And I counted until like 27 seconds. And then he goes, starts breathing again. I thought, man, he's going to make it. And then he would stop for about 45 seconds and keep breathing, and then he would do that again. And he was having these apneic pauses for a lot of time. Well, the reason that the study of sleep has become so important is we found out how many people really have it, probably about 25%. And it's really significant because it's really hard on their brain, it's hard on their heart. A lot of people die in sleep apnea because when you go into sleep apnea, we have found that if you have them hooked up to an EKG, they start having all kinds of weird heartbeats. And so a lot of times people will get sent to the sleep apnea lab, and after about 30 minutes, they just cancel the study. They say, well, your heart has already stopped 14 times in the last 27 minutes. You have sleep apnea. Bye. You need a CPAP machine. And that's the way the thing is treated is by basically blowing a little air into your face, which keeps all those things back in there that are falling together. Your tongue and your pharynx and so forth are all kind of constricting down. And if you just put a little bit of pressure on that, it keeps them open so that you keep breathing and you don't get the stops.
Is that basically all that it is? It's just everything just kind of shutting down your airway?
Yeah. So, and you see now, there are actually some devices that are coming out that hold your mouth open, hold your tongue out, different things like that.
A few of the ones that go in your nose work to hold your nasal passages.
No.
No, I didn't think so.
This is not where you get blocked.
I didn't think so.
You get blocked back in there.
Is it
Yeah.
genetic?
What?
Is it genetic? Like the way your throat is structured or something?
I don't think so. It's so common. Okay, so that's sleep apnea. Our book we used to ask you students to read the chapter on EEG, which is in the lab book. We didn't test on it, but it might be something you might enjoy reading. It's basically the study of brain waves. That's what an EEG is. And we actually have a BioPack, a computer thing where you can hook yourself up and do an EEG on yourself. But basically, your brain waves kind of look like that when you're awake. REM sleep is called rapid eye movement. That's what the REM stands for. And that's the time when you're usually dreaming and your eyes are moving around and looking at different things like you're in the dream. And it's also a very good type of sleep. Very deep sleep is very slow. And this is kind of the pattern that most of us go through during the night. You get a little REM sleep at first, and you get a little more, you get just usually a minute or two of REM sleep at a time. So those dreams that you think last for hours and hours really don't. They just last a few seconds. And then we finally wake up towards the morning. We do have a fair amount of REM sleep right before we wake up, and you probably all remember dreaming right before you wake up. Those are the dreams. Those are the only dreams you ever remember, by the way, is the ones you just had a few minutes before you woke up. This is a really important time that you are getting that, because REM sleep has a very curative and healing effect on your brain. I'll just rush through this here. Deep sleep, also called slow wave sleep. Your entire body really relaxes. There's not a whole lot of thinking going on. Your cerebral cortex is very minimal. This would be like a bear hibernating during the winter. Heart rate, blood pressure, respiratory rate, everything goes down as much as 30%. So it's restorative to your whole body. Rapid eye movement is when active dreaming occurs. Your blood pressure may go up and down depending on what you're breathing about, and you also get this rapid eye movement. So when they study people, oftentimes they put little monitors on their head because they can follow the electrical activity of the muscles of your eyes moving. REM periods last only about 5 minutes. They can go up to a little longer, but maybe that's a total number over 8 hours. The reticular activating system is kind of a nebulous area of your brain. It's not any particular anatomic area. It does sort of live in the brainstem, but you can't put your finger on it and say that's the reticular activating system. The reticular activating system is a good way of thinking about it is this is this part of your brain that activates your brain. So if your reticular activating system is asleep, you are asleep. If your reticular activating system is really asleep, you're in coma. Okay? I'll just leave it at that because I don't think that matters too much. Let's talk about some fun stuff. Let's talk about LSD. LSD is a funny drug. It's not really used much anymore, I'd like to think. It's lysergic acid diethylamide. It was really big back in the 60s, very powerfully hallucinogenic, so people would have all these hallucinations, and it was generally very pleasant. But then oftentimes they would have these flashbacks that weren't so pleasant, these what were called bad trips. And so people would have episodes of hallucinations that were freaky, and they hated it. And LSD basically works by activating your serotonin receptors. We're going to talk about serotonin here for a minute, because serotonin is very important in the way our brain works. If you release enough serotonin all at once, which is what LSD can do, it'll give you these crazy hallucinations. Most drugs don't do quite that much, but they can. And probably the best one, probably the most active one these days is what's called methamphetamine. Methamphetamine is a drug that is sold and manufactured in people's bathtubs, and people sniff it usually to start with, and it apparently gives you the highest high that's possible, because methamphetamine causes a release of huge amounts of serotonin. Serotonin makes you feel good, okay? Serotonin is a wonderful feeling. It just makes you feel high, everything is right with the world. The problem with meth is you take the meth the first time and you get really high, and all you want to do is do that again. The next time you only get about this high, and the next time you get about that high, and the next time you get about that high, and by that time you're addicted. Sometimes a lot of people say you're addicted to methamphetamine after one dose because it's so wonderful, such a wonderful feeling that you spend the rest of your life trying to get more, and the people obviously screw their lives up really badly. We had a cop out in the Dalles. It was kind of interesting story. Maybe y'all have seen his show. He worked in the jail out at the Dalles, and they kind of knew who in town was doing meth, and he just started taking an extra picture of everybody when they would come in on a meth charge, and he would keep the pictures. And then, they would get rearrested 6 months later, and he gets another picture. And then he put together this slideshow that just showed these people totally falling apart from the use of meth. They would get acne, their teeth would fall out. It was just, and they would age, and their hair would fall out, and they looked just awful. They looked like they'd aged 20 years in 1 year. And his idea, which I think was really good, he says, you know what, we can't get these kids to quit using this crap. But I bet if we show them how ugly it's going to make them, they might stop using it. And it's become kind of a national thing. His set of slides, and lots of other people have now contributed more, of just this total destruction of these people and how awful they look after using meth for a while has been used to help people try to stop. But it's incredibly addictive. So let's talk about serotonin for a minute, because I've said that serotonin is great. Serotonin makes you feel better. And so there's a class of drugs that you've probably heard about also, and they're called SSRIs. Anybody? Serotonin.
Selective reuptake.
Selective serotonin.
Reuptake inhibitors.
Very good. Reuptake inhibitors. All right. In other words, inhibitors. If you could get your brain to not take back up your serotonin and let it just stay in your brain, you'd feel better. Okay? And that's what this class of drugs does. It selectively, for serotonin, inhibits the reuptake of it. So it just stays there in your brain. Well, these are all the antidepressive drugs. I think this has been the greatest set of drugs ever invented in history, because I think it truly does work. And I was not a psychiatrist, but I dealt with lots of patients that had cancer, and a lot of times cancer patients were just depressed. It was like life wasn't really worth living because they were so down about it. They thought they were going to die. They were having to go through all these treatments, run up all these bills and all that stuff. And so I oftentimes put many patients on SSRIs, and I was amazed at how well it worked. We would sit around in the doctor's lounge out in the Dalles and say, what do we got to do to put this stuff in the water system? Because everybody was depressed in the winter out there. Yeah.
But doesn't it make it harder to, because if your body's constantly getting that serotonin, it doesn't make its own serotonin to high enough levels, so therefore you're inhibiting your own ability to...
No, you keep making it. It works. It raises your level of serotonin in the brain. The drugs, Prozac was kind of the first and main one. It allows the serotonin to hang around at the synapses in the brain and generally makes you feel better. SSRIs is the word you need to know, I guess. Celexa, Luvox, Paxil, Zoloft. There's probably a dozen more.
Wellbutrin.
Wellbutrin, right. There's lots of them that have been trying to attack one thing or another, trying to help people get off cigarettes or get off nicotine or whatever. They really do work. And I have to tell you that I used to take it in the winter, because out in the Dalles we had this grayness that would come on for about 3 months. On the other side of the Cascade Mountains, there's this like weather inversion, and it would just get depressing. In fact, the only place you could go to get sun for 3 months was up to Mount Hood. You had to go skiing to get in the sunshine, because the cloud layer was at about the 4,000 foot level, it seemed like, all over eastern Oregon. But anyway, so I would take it in the winter for about 3 months, for several winters, and I wouldn't even feel anything, but after about a month of taking it, I would just sort of say, wow, I don't feel like I've got that weight on my shoulders anymore. I just feel better. And you couldn't put your finger on anything, but it was enough for me to know that it really did work. And then I had so many patients who it would save their life. I think these were wonderful drugs.
There's no side effects?
Huh?
There's no side effects or?
Is there no side effects? Not much, but boy, there's not much. It probably gives you ED. I don't know. Parkinson's disease. You guys know that. Who's that actor that? Michael J. Fox has got it. Another guy who has it is Muhammad Ali, the boxer. Parkinson's disease is caused by not enough dopamine. Dopamine is a is a neurotransmitter in your brain as well. When you take amphetamines or speed, it causes a big release of dopamine as well. And very large doses of it can cause symptoms sort of like schizophrenia. The point being with DOPA is that we have not been able to come up with a pharmaceutical form of DOPA that you could take, like one pill a day, that would slowly release into your system and keep your level of DOPA at about the level you needed it to be at. So the problem is you have to take it 4 or 6 times a day. In other words, every 6 or every 4 hours. And in that time, your DOPA levels go up and down, up and down. I've heard it said that Muhammad Ali, being Muhammad Ali, never takes his pills on time. And that's why you've seen him a number of times, I'm sure, just being out of it. Because he doesn't take his DOPA. Whereas Michael J. Fox takes his exactly on time every dose. And he's able to be pretty darn functional because of that. But it seems like the pharmaceutical industry could come up with a slow releasing form that would work better.
Don't we have patches all over the place that do time release kinds of things? So
Well, a lot of drugs are that way, but they haven't been able to do that with DOPA. I mean, yeah. How did I get back? I guess I hit the button a few times.
Huh. That's the end.
It must be the end.
Yep.
Okay, so the things we talked about today with the autonomic system are important. It's not I've left out things in the chapter, but please understand that the things I did talk about are very important because they affect so many things about our lives and the chemistry of life and the pharmaceutical drugs that we take for a bazillion things. Yes?
So, I mean, I know I'm barely certain of the answer. I noticed that chapter when I was attempting to read chapter 15 and with 16 of the slides, there's a lot of content that's been